नमस्कार। आज हम बात करने वाले हैं एविडेंस बेस्ड प्रैक्टिसेस इन फिजियोथेरेपी। इट इन्वॉल्व्स इंटीग्रेटिंग द बेस्ट अवेलेबल रिसर्च एविडेंस with clinical expertise and patient value to make informed decisions about patient care. It emphasizes using scientific research to guide clinical decision making and optimize treatment outcomes. Its key component like research evidence, clinical expertise, patient value and preferences, into which research evidence focuses on systematic review and meta-analysis, whereas it also includes RCTs, that is randomized controlled trials, and clinical practices guidelines. After which, clinical expertise focuses into professional judgment and clinical reasoning, whereas patient values and preferences focus on shared decision making and patient centered care. This is all about the evidence based practices. Now, we will go into the depth of research evidence, that is include systematic review and meta analysis, which help to summarize and critically appraise multiple studies on a specific intervention or condition to provide high level evidence, whereas RCTs investigate the effectiveness of intervention by comparing treatment with control groups, helping to establish causal relationship, whereas clinical practices guidelines focused on systematic review. Based on the systematic review, guidelines provide recommendation for best practices in managing a specific condition or population. Now, a clinical expertise which focuses on professional judgment, and it emphasizes physiotherapists as use their knowledge, skills, and experience to interpret research findings and apply them appropriately to individual patient cases. Whereas clinical reasoning, it involves critical thinking and problem solving to assess, diagnose, and develop protocols or treatment plans based on their patient specific factor. So we will now focusing on patient value and preferences, that is shared decision making. Basically, it involves discussing treatment options, risk, and their benefits with patient to align intervention with their goals, preferences, and cultural beliefs. Another patient centered care